Every day in my clinic, I see people in their 50s, 60s, even their 70s walk in with the same feeling. My body just doesn't listen to me anymore. Some tell me, "Doctor, every morning I have to sit on the edge of my bed for a few minutes before I can even stand up." Others sigh and say, "My hips are so stiff that even bending down to tie my shoes feels like a challenge." And then there are the more private things people hesitate to mention. Getting up to use the bathroom several times a night, constipation one day, bloating the next, a dull ache in the lower back that comes and goes for no clear reason. All of this makes them think, "Well, I'm getting older. I guess this is just how it is." But I always remind my patients of one thing. Your age isn't the problem. The problem is that no one ever showed you what to take care of. In more than 30 years of practice, I've discovered something very few people ever hear. Many of these symptoms that feel like they're coming from all over your body actually trace back to one small area, hidden deep inside, a place most of us never pay attention to in our entire lifetime. A group of muscles that supports every step you take, stabilizes your spine, helps your digestion work smoothly, and even plays a role in how well you sleep. And yet, most people only discover this area when their body starts to fall out of balance. I'm talking about the pelvic floor, a sophisticated system of muscles and connective tissue that many of my patients have never even heard of. What worries me most is this. If older adults were taught how to care for their pelvic floor earlier in life, many could have avoided decades of back pain, hip stiffness, digestive struggles, and bladder problems. And here's the good news. You don't need a gym. You don't need equipment. You don't need to be flexible or athletic. A few gentle movements, just a few minutes a day, can start to wake up this sleeping set of muscles, bringing oxygen, blood flow, and mobility back to your entire lower body. In today's video, I'm Dr. David Warren, and I'm going to walk you through a series of movements designed specifically for people over 50. These exercises help reduce pain, improve hip and back mobility, and support healthier digestion and bladder function. We're not here to do heavy workouts or complicated routines. We're focusing on restorative movements, small intentional exercises that reawaken the body and help you feel relief in just a few days. And if you've ever thought, "I'm too old to get better," I want you to set that thought aside for now. Your body has never given up on you. It's simply waiting for the right signals. 1. Awakening the pelvic floor with a gentle hip opening stance. Many of my patients are surprised to learn that the pelvic floor doesn't weaken just because of age. It weakens because it's been silent for too long. When we sit for hours, blood flow decreases, and the deep muscle fibers stop receiving proper nerve signals. As a result, the muscles become slow to respond, less elastic, and more likely to trigger back or hip discomfort. The pelvic floor connects to the hips, lower abdominal muscles, and the spinal stabilizers. So when the hips tighten or lose mobility, the entire neural feedback loop of the pelvic floor slows down. That's when you start noticing things like difficulty standing up after sitting, a heavy or tight feeling in the lower belly, short, stiff steps when you walk. This simple hip opening stance helps release soft tissue and gives the pelvic floor the space it needs to start moving naturally again. With just a few minutes a day, you may notice less morning stiffness, easier transitions from sitting to standing, a clear sense of your hips opening, reduced pressure on the bladder and bowels. Many people over 60 tell me they feel their lower belly lighten up within the first week. How to do it? Stand tall and place your hands on a table or sturdy surface. Step your left foot back about 18 to 20 inches. Bend the front knee slightly and keep the back heel down. Take a slow breath in and let your hip gently open. Hold for 20-30 seconds, then switch sides. Don't lean forward or arch the back. Let your body open naturally. Dr. Warren's tip. I always tell my patients, hip opening isn't about stretching. It's about clearing the path for the pelvic floor, the deep core, and the spine to work together. The steadier your breath, the easier your body releases years of tension. 2. Pelvic floor breathing. Restoring the rhythm between the diaphragm and the pelvis. One of the most fascinating discoveries in restorative medicine is that the pelvic floor and the diaphragm work as a pair, like two doors opening and closing with every breath. But as we age, that rhythm gets disrupted. Stress, shallow breathing, or years of chest breathing throw the system out of sync. When you inhale properly, the diaphragm lowers, gentle pressure builds in the abdomen, the pelvic floor naturally softens. When you exhale, the diaphragm rises, the pelvic floor engages lightly to support the spine. But after age 60, most people breathe high in their chest. This causes the pelvic floor to stay slightly tense all day, leading to difficulty with bowel movements, lower back pain, a heavy feeling in the lower belly, restless sleep because the pelvic floor never truly relaxes. When the breathing rhythm returns, people often feel softer, more flexible lower back muscles, a relaxed belly, smoother digestion, less urinary urgency, deeper, more restorative sleep. Many of my patients have told me, "Doctor, I never imagined a simple breath could relax my whole lower belly." How to do it? Sit on the edge of a chair with a relaxed but upright spine. One hand on your lower belly, one on your chest. Inhale slowly through your nose, letting the hand on your belly rise first. Imagine your pelvic floor gently softening as you breathe in. Exhale slowly and feel the pelvic floor lift slightly. Repeat 8 to 12 times, 2 to 3 sessions per day. You don't have to force anything. Let the breath lead, your body will follow. Dr. Warren's tip. People think a weak pelvic floor needs strengthening, but before strength, it needs the ability to relax. Breath is the key that unlocks the entire system. 3. Restorative chair. Hover, activating the hips, pelvic floor and lower back. Without strain, working with older adults has taught me something important. You don't need intense workouts. You need movements that wake up the brain to muscle connection. The restorative chair hover is one of my favorite techniques. It's not a squat. It's not sitting. It's the gentle space between, where deep, stabilizing muscles turn back on. When you hover just a few inches above a chair, the glute muscles reconnect with the hips. The thighs work at a safe, moderate level. The pelvic floor responds with gentle support. The spine stays stable without compression. This halfway position helps restore your sense of control, something many people lose with age, leading to unstable steps or slow transitions from sitting to standing. Within 1 to 2 weeks, people commonly notice stronger steps, less dependence on armrests, reduced hip and thigh fatigue, improved stability in the lower belly and lower back, lower risk of falls. Some even say they feel urination becomes easier because the pelvic floor becomes more responsive. How to do it? Stand with a chair behind you, feet hip-width apart. Push the hips back as if sitting, but stop 2 to 3 inches above the chair. Keep the spine tall, knees aligned with toes, weight in the heels. Hold for 10-20 seconds and stand back up. Repeat 5 or 8 times. This isn't strength training. It's a wake-up call for your body. Dr. Warren's tip. You don't have to sit deeply to create change. You simply have to remind your body how it used to move. 4. Retro step activation. Restoring hip strength and pelvic stability. Many people assume progress means moving forward, but in physical therapy, sometimes a small step backward creates the biggest change. For adults over 50, this movement reactivates the deep hip stabilizers, muscles that coordinate directly with the pelvic floor. When you take a gentle step back, the gluteus medius fires to maintain balance. The hamstrings and glutes stabilize the hip joint. The pelvic floor adjusts to keep the body aligned. The lower belly tightens slightly to protect the spine. This is a natural coordination pattern we used all the time when we were young, but it fades when we stop moving in varied ways. Practice daily. This exercise helps reduce hip discomfort caused by weak stabilizers, improve hip mobility, make standing and stair climbing easier, decrease strain on the lower back, restore the pelvic floor's natural reflexes. Many patients have told me they feel more regular in the bathroom after adding this, because the lower belly and pelvis move more harmoniously. How to do it? Stand tall, hands on a table or sturdy chair. Keep weight on the supporting leg. Step 1 foot back 8 to 12 inches without leaning forward. Slightly bend the supporting knee. Hold 5 seconds, noticing the engagement in the hip and lower belly. Bring the foot back in and switch sides. Repeat 10-12 times each leg. If your hip wobbles a bit, that's a good sign. Your stabilizers are waking up. Dr. Warren's tip. I think of this exercise as a health check. If you can step back without wobbling, your hips, core, and pelvic floor are working in harmony. If you sway, that's your invitation to begin rebuilding. Here's the English version in a natural American spoken style. Keeping Jung-Yong, Dr. David Warren. 5. Gentle lumbar rotation, releasing pressure and easing the pelvic floor through nerve pathways. There's something a lot of older adults don't realize. Your pelvic floor and your lower back are connected through the same nerve network. That means when your lower back is tight and locked up, the signals going to your pelvic floor get scrambled too. That can show up as urgency to pee, constipation, or that constant tight, heavy feeling in the lower belly. That's why one of the most important steps in recovery is to soften the lower back so the whole system can finally breathe again. When you gently rotate your lower spine, the L3, L5 joints get lubricated again, the spinal muscles relax and stop pulling so hard on the hips, the nerves that serve the pelvic floor feel less compression, blood flow to the lower belly improves. All of this makes it much easier for the pelvic floor to adjust its tension. Instead of staying slightly clenched all day, like many people experience after 60. Just 2 to 3 minutes a day can help you. Ease lower back tightness when you wake up, reduce that heavy feeling in the lower abdomen, improve digestion and reduce bloating, make bowel movements easier, lessen pain that radiates down into the buttocks or groin. Many of my patients have told me, "Doctor, this rotation exercise feels so gentle, but it relaxes me so much that I'm sleeping better at night." How to do it correctly. Lie on your back on a bed or a soft mat. Bend both knees and place your feet flat. Relax your shoulders and open your arms out to the sides. Slowly let both knees drop to the right, only as far as is comfortable. No forcing, no hard twist. Take 3 deep breaths, then bring your knees back to center. Drop them to the left and repeat. Do 6-8 rounds on each side. You don't need a big twist. You just need to let your spine soften. Dr. Warren's tip. I always remind my patients, the magic in this exercise is its gentleness. An older body doesn't need to be cranked or forced. It just needs a soft signal that tells the blood and nerves, you can move again. 6. Anterior hip and lower belly release. Taking pressure off the pelvic floor from the front. During my consultations, I often hear, "Doctor, I don't know why my lower belly always feels tight, like something's pressing on it." Or, "Sometimes I get this nagging discomfort that runs from my groin out toward my hip. It really bothers me." Most people don't realize that the front hip muscles, hip flexors, and the fascia in the lower belly are directly connected to the pelvic floor. When these tissues shorten from sitting too much or not moving enough, they pull the front of the pelvis downward, increase pressure on the organs, and force the pelvic floor to work the wrong way. Think of the front hip muscles as a pull cord system that links the thigh, the hip, the lower back, the lower belly. When those muscles are tight, the lower belly is compressed and can't move freely. The intestines get squeezed, leading to poor digestion or gas. The pelvic floor is pulled forward and has a hard time relaxing. The lower back arch increases and becomes painful. Put simply, tight front hips, a pelvic floor that's working wrong all day. Real-life benefits. Just a few minutes of releasing the front of the hip can reduce pressure on the bladder, ease that constant urge to pee, improve bowel motility, relieve lower back pain that radiates into the groin, help the pelvic floor relax more naturally when you take a deep breath. For many people over 60, fixing just this one area makes walking and standing feel more comfortable all day long. How to do it correctly. Kneel on one knee if your knees are sensitive. Place a towel or cushion under the knee. Place the other foot in front of you with the sole flat on the floor. Keep your back upright. Don't lean forward. Gently shift your hips forward about 1-2 inches. just enough to feel a mild opening in the front of the hip and lower belly. Hold for 15-25 seconds, then switch sides. Repeat 2 to 3 times on each side. This isn't about a deep, intense stretch. It's about flipping the switch and giving the tissue permission to release. Dr. Warren's tip. I often tell my patients, sometimes the pain you feel in the back actually starts in the front. Freeing up the front of the hip is like loosening a knot. Suddenly, the whole lower belly and pelvic floor can relax again. 7. Deep core glide, helping the pelvic floor work smoothly and reducing internal pressure. When people hear core, they usually think of planks or sit-ups, exercises that are not ideal for most adults over 50, especially those with herniated discs, spinal degeneration, or a weak pelvic floor. That's why in my practice I teach a technique called deep core glide, a gentle, precise way to activate the deep abdominal muscles without straining the spine or the pelvic floor. This exercise helps restore the coordination between the lower belly, pelvic floor, and lower back, which in turn reduces pressure on the organs, stabilizes the pelvis, and improves balance when you move. The deep core muscle, the transverse abdominis, works like a natural belt wrapping around your waist. When it's doing its job, your spine is supported, the pelvic floor receives clear, steady signals. Pressure inside the abdomen stays balanced. Digestion and bladder function become more regular. But when this muscle goes offline, your body overuses the big muscles in the thighs and lower back. That leaves the pelvic floor overloaded and irritated, which can cause discomfort all day long. What people notice after practicing deep core glide. After a short period of consistent practice, most older adults report less lower back pain when standing for long periods, a lighter, softer feeling in the lower belly, a pelvic floor that reacts more naturally with less urgency, better posture, and walking mechanics. Easier stair climbing because the whole body works as a team. Some patients even tell me, "Doctor, it feels like my lower belly finally has life in it again." How to do it correctly. Lie on your back with your knees bent and your feet flat on the floor. Place 2 fingertips about 1 or 1.5 inches to either side of your belly button. Take a gentle breath in. As you exhale, lightly draw your lower belly inward, as if you're slowly zipping up a thin jacket. Don't suck your stomach in hard, and don't arch your back. Hold for 3-4 seconds, then relax. Repeat 10-12 times. You'll feel a subtle movement under your fingertips. That's your deep core kicking in. Dr. Warren's tip. I always tell my patients, recovery isn't about doing more. It's about doing the right thing. When your deep core is working properly, the pelvic floor automatically knows how to join in. That's the key to regaining the stability you thought age had taken away. Closing message and disclaimer, English version. After working with thousands of patients over 50, there's one thing I always want to remind people of. Our bodies don't fall apart because of age. They struggle because we stop sending them the right signals. In this video, we walk through 7 gentle restorative techniques, movements that look simple, but reach deep into the pelvic floor, the hips, the lower spine, the breathing system, and even your digestive and bladder function. If you noticed, none of these exercises were heavy or intense. No equipment, no advanced fitness level required. What really matters isn't brute strength. It's bringing back coordination between the muscle groups your body has forgotten how to use together. A quick recap. We opened the hips to create space for the pelvis. We restored the breath rhythm so the pelvic floor could finally relax. We activated the hips and deep core to bring back stability. We softened the lower back so the nerves could breathe. Each small movement is like a gentle knock on the door of your nervous system, reminding your body, you still know how to do this. And when that system wakes up, you'll start to feel it. Steadier steps, deeper sleep, a calmer belly, a lighter pelvic area, and most importantly, a sense that you're in charge of your body again. Dr. Warren's gentle advice. Start with just 1 or 2 exercises a day. Don't try to do everything at once. Your body will tell you when it's ready for more. I've seen so many patients say, I'm too old to change, and just a few weeks later, they come back and tell me, Doctor, I feel like my body has gotten younger. That's why I truly believe you don't need perfection. You just need patience. Your body will find its own way to heal. If today's exercises gave you even a little bit of hope, comfort, or simply the feeling of, maybe I really can do this, let me know by hitting like, subscribing to the channel, and sharing this video with a friend or loved one who might be struggling with the same issues. Your support helps me keep creating helpful content for the 50-plus community. People who absolutely deserve to live strong, steady, and confident at every stage of life. Disclaimer: this video is not a substitute for medical advice, diagnosis, or treatment. If you have underlying health conditions or unusual symptoms, please talk with your doctor or a qualified healthcare professional before starting any new exercise program.